Okay, so today we are going to be screening our patient's range of motion. So we're going to start with the cervical ranges of motion. So head face forward, and we're going to tilt our head up towards the sky, and then look down towards the floor as comfortably as you can, and back up. This was testing the flexion and extension of our patient's range of motion. Then we are going to bend our head to the right, and then bending it to the left, testing our lateral flexion, and then facing forward, turn our head from side to side. Good. This is going to be testing our rotation. Then stick our chin out and back in, testing the protraction and retraction. Okay. And then next we're going to be testing the shoulders. So the patient's going to stand up, and then with your arms straight, you're going to lift them up to the sky. Perfect. And back down. This is testing his flexion. And then bringing your arms out straight to the sides. Good. This is abduction of the arms. You can go back down. Okay. And then bring your elbows straight back. There we go. That's testing our extension. And back to the sides. Okay. So keep your elbows bent. And then we're going to turn our wrists outward and back inward towards our stomach. Give our stomach a hug. Testing our internal and external rotation. Okay. And then another combined test to test multiple planes of motion at once. With one arm, you can try to bend and touch behind your head. Okay. And back down. This is combining the tests of flexion, abduction, and external rotation. And then you can try to touch behind your back with one arm. Good. This is also testing multiple planes of motion. This would be testing their shoulder extension, adduction, and deduction and internal rotation. Okay. Arms back to the sides. Okay. We're going to put one arm out, and then we're going to reach all the way out as much as we can, and then reach out across our bodies, keeping that arm straight. This is testing the horizontal abduction and adduction. Okay, perfect. And you can put your arms down. Okay, you can have a seat. Next, we'll be testing the elbows range of motion. So we're gonna have our elbows bent. Okay, and then extend them out. Perfect. And back down. Okay. Next, keep your elbows bent. Face your palms to the sky. Okay, and then now turn your hands to the palms to the floor. Testing the pronation and supination. All right, hands down. Okay, then we will be testing wrist flexion and extension. So arms bent, make a fist, and we're gonna flex our fists upward and extend them downward. Very good. Okay, hands down. Okay, and then hands out flat. Now we're gonna try to keeping our hands flat and our arms straight. We're gonna turn our thumbs inward. Okay, back out. And now we're gonna try and turn our pinkies outward. Perfect. Okay, this is testing the radial and ulnar deviation. Okay, can we make fists with your elbows bent? Okay, and now extend the fingers out. Stretch. Okay, wonderful. Okay, and then can you give me a big thumbs up? Stretching the thumbs. All right, so this was testing our finger flexion and then our thumb extension. And then next, we will be testing the lumbar region. So we're gonna be standing up. Okay, with your back straight and legs straight, we're gonna try to touch our toes as comfortably as we can. Okay, and back up. Very good. And then keeping your hands at your sides, do a little bend back for me. There we go. This is testing our extension. And back to the center. Okay, so we just looked at the flexion and extension of the lumbar region. Next, bending side to side. There we go. And then we're going to cross your arms across our body and then rotate left to right, testing the rotation of the lumbar. Perfect. All right, you can have a seat. Next, we're going to be screening for the hip. So first, to test the hip flexion, knees bent, feet flat on the floor. One leg is going to come up like you're marching. And back down. So for this test, including all the other tests, we have to make sure that we test bilaterally, but for the sake of this video, we're just gonna do one side at a time. So next we're gonna, also another way you can test extension, which we are not gonna do today, but you can have the patient stand up and keeping their knees straight and extend their leg kicking backwards. Okay. So keeping your legs bent, we're gonna pick the foot up off the floor and we're gonna turn it outward, okay, and back inward across the body. Perfect, and back down. This is testing the hips external and internal rotation. And then we're gonna try to bring our knees as close together as possible. Okay, and then bring the knees as far out as possible. Perfect, back together, testing the abduction and adduction. All right, next we're gonna be screening for the knees. So we're just gonna have our leg bent off the floor and then extend it straight out. Perfect, that's testing the extension. And then can we bring it back in as much as possible? Bending it, there we go, there's the flexion, perfect. And back down. All right, and last but not least, we're gonna screen for the ankles. So keeping our feet flat on the floor. We're gonna point our toes up to the ceiling, keeping our heel to the ground. Perfect, and back down. That was our dorsiflexion, and then keeping the ball of our foot connected to the floor and pick our heels up. That's testing our plantar flexion. Perfect, and back down. And then without moving your knees, can we turn our toes inward? There we go, back straight, and outward. Perfect, and back. That's testing the inversion and eversion of the foot and ankle. And then last, if you want to test the flexion and extension of the toes, you can have them point their great toe up. Okay, and then try to, how about now, curl your fingers down, all the toes. Perfect, there we go. And that's how you screen for all the multiple ranges of motion. Next, we're gonna be screening the myotomes for this patient. So we're gonna start off screening the upper quarter. So typically when we screen, we're supposed to hold each stabilization for around 5 seconds, but for the sake of this video, we're just gonna run right through them. And also, any of these, if they can be done bilaterally, they should be done bilaterally. Okay, so first we're gonna test the C1 and C2 cervical flexion. So I'm gonna start off by stabilizing the back of the patient's head, and then using my hand, I'm gonna apply pressure, and then they're gonna give some resistance and not allow me to push back. Perfect, okay. Next, we will be testing our C3 myotome, which is stabilizing the side of the head with one hand, and then giving and then pushing, and then they're gonna not let me push that other direction. Perfect, okay. Next is our C4 myotome, which is shoulder shrugs. So I'm gonna have the patient shrug their shoulders, and then you're not gonna let me push them back down. Perfect, and back down. Good, all right. Next, our C5, we're gonna have our patients have their arms bent outward, and then I'm gonna get some wrist pushing, some on the elbows. Perfect, and back down. Okay, then next, we're gonna test our C6 myotome. So there's two options for this. So you can either do elbow flexion or wrist extension. So we're gonna have our patient bend their arms and then make a fist. Okay, I'm gonna stabilize their arm and then I'm gonna pull their arm and you're not gonna let me pull it back. Perfect. Okay, bend it a little bit more up. There we go, try again. And down, okay. And then turn your hands right around. And then we're gonna extend the wrists up. And then same thing, I'm gonna pull and you're not gonna let me do that. Perfect, okay, and back down. Then next for our C7 myotome, it's gonna be the same thing, but kind of opposite. So again, we're gonna bend the elbows, make a fist. Now I'm going to push and you're not gonna let me push. Perfect. Okay, and now same thing, flip, extend the wrists, and I'm gonna push, but you're not gonna let me. Beautiful, all right. And then next we're gonna be testing our finger flexion. So they're gonna make an O with their fingers, and then you're not gonna let me break this O with my 2 fingers. Perfect, all right. And then last but not least is our abduction and adduction of the fingers. So fingers out, spread them, don't let me push them in. Okay, perfect. And then to test the abduction, we would go between each fingers and test the separation between each set of fingers. All right, next, we're gonna be screening the lower quarter myotomes. So to start off, we're gonna test L1 and L2. So we're gonna test our hip flexors. So keep your knee bent and raise your leg up. I'm gonna push it back down, but you're not gonna let me. Okay, perfect, and back down. Remember, we're always testing bilaterally, but for video purposes, we'll be testing unilaterally. Next, we're gonna be testing our L3. So extend your leg outward, but keep a slight bend to it, and I'm gonna push, but you're not gonna let me. All right, perfect, and back down. Okay, next, we're gonna be testing the dorsiflexion of the foot. So keep your feet flat on the floor, and then keep your heel connected to the floor, and we're gonna point our toes up. Feet up, heel up on the floor, and then I'm gonna push, you're not gonna let me. Okay, perfect, and back down. Okay, you also wanna make sure that you're testing their heel toe walks. So keep your heel to the floor and toes up. Ready, down, and now heels up. Toes up, heels. Perfect. Okay. Next, we're gonna be testing our L5 myotome. So keeping the same position, except now I want us to extend our great toe up, and I'm gonna try and push it back down, and you're not gonna let me. All right, and down. Okay, wonderful. And then for our S1 myotome, we actually have multiple options. So we can do our ankle plantar flexion. So with our leg extended, point our toes out. I'm gonna push and you're gonna try and keep your foot extended. And perfect, back down. Okay, so, or you can do eversion. So I want you to pick your foot up and turn it out to the side. Nope, other side, there we go. And you're not gonna let me push. And perfect, back down. Okay. And then last, if you wanna do hip extension, you would have the patient lie down flat on the table and then keep their knees straight and then lifting their leg up off the table and not allow the PT to push back down. And then last but not least, for our S2 myotome, we're gonna work on knee flexion. Okay, so we're gonna bend the leg, but lift it off the ground, and I'm gonna pull, and you're not gonna let me break the bend. Perfect. Okay, so if I notice any kind of issues in any of the myotomes, say like I noticed any weakness in the C7, C8, or T1 myotomes, I would wanna maybe test his grip strength or do different testing of his upper body strength.